Good morning, everyone. How's everyone? Good? Good night's sleep? Well, I would like to say that SIS has become known to have big announcements made, and we have a huge announcement today. So Patricia is joining us, but you have to stand by. We have some other things to get through, but there's a huge announcement coming down the road here in this interview. How are you today?
I'm good, thank you.
This is your first SIS?
It is.
Things going well?
Yeah, so far.
Okay. It's life-changing. Your life is going to be totally different from now on.
That's right.
We at Landmark Ventures, we are UnitedHealth in the group. So I paid my copay to interview today. Hopefully this is a network.
That's right.
But you are the Chief Sustainability Officer. You've been in this role for 5 months, I think. But
actually, a little over 90 days.
Okay. But
and counting.
Also important, you have been the Chief HR Officer as well. Mm-hmm. What I like about your background and the work that you're doing right now is that it mixes workforce development, future of work, but also health equity. And it's something that we've been talking about in the SIS community for a couple years, future of work for a handful of years, but over the past couple years, health equity a lot more.
Absolutely.
And so I really appreciate your role in this, and it's going to be interesting getting into some of the context.
Yeah.
Let me provide some context to the audience here, to everybody, in terms of what your group does and is. So UnitedHealth, with more than 45 million members, is one of the largest health benefits businesses in America. Through Optum, your care delivery and health services business, you have about 60,000 physicians and about 2,000 clinics, community pharmacies, surgical centers, and local care delivery organizations. You work with 4 out of 5 health plans, 9 out of 10 hospitals, and 90% of companies in the Fortune 100. Altogether, about 148 million people rely on UnitedHealth Group for care. Wow.
Yeah.
That's a lot.
It is.
So given that context, and let's look at the past few years, especially on the front lines, a lot of burnout. We've seen it on the news. We have friends in the business, but just a lot of burnout. How are you approaching that? How are you thinking about burnout as a threat to sustainability in our health system?
Well, first, thank you for having me today. It's really an honor to be here. It's an honor to serve 148 million people with our mission. And, you're right. The last 2 years have been super challenging for all of our healthcare providers. The services that they have provided for the last 2 years and actually beyond that has been really nothing short of extraordinary. And burnout existed before the pandemic, and it is, it's much worse 2 years later. There are a lot of, different factors that are contributing to that, and just on a statistical basis, our research shows that at least half of our clinical workers today say that they are burnt out, physicians included.
I can believe it.
And 2 to 3 of them say that half of them say they will leave in 2 to 3 years. They'll leave the healthcare field, so that could be super, as you can imagine, catastrophic.
And there's so much ramp up to get to become
right.
a physician,
Education
nurse,
takes a
practitioner.
long time to get there.
Yeah.
So we believe, given our population of people, it's our duty to do whatever we can to help to ease the burden on them and to think about how we can prepare to assist the pipeline of talent that's coming into those clinical fields. One of the biggest areas as an opportunity for us is to fill the pipeline of talent. And one of the contributing factors is we don't have enough people entering the healthcare workforce as we do leaving. And that's why what we're going to talk about today is so important. The other thing, and just some numbers, just for those of you, in the audience here, what we see says that we will reach 1 million shortages in nursing by the end of this year. So if you can just imagine that. And then there are studies out there that predict in 11 years, we'll have 140,000 fewer physicians. So just given, all of the, what we've been through in the last 2 years, and you can just see, how taxing that will be on the healthcare system. And so, focusing on that pipeline of talent is super critical. The other thing that we see is, as you look across the healthcare landscape, there's not enough diversity. Black and Hispanic people make up about 30% of the population in this country, yet they make up 10% of the healthcare workforce. So there's tremendous opportunities there. And why is that important? It's important because when we think about diversity in the healthcare pipeline, we think about what we call cultural competence. And that is really where physicians who may be from similar backgrounds as their patients, we see data and evidence that suggests that they have a better opportunity to build very strong relationships, that they can build the trusting relationships with the physicians because they can relate to their experiences, the patient's experiences. And we see that there are better outcomes when that happens. And one of the areas that we see evidence of this most apparently is in the area of maternal and newborn health. We have seen where, and these are really terrible statistics, but Black mothers in this country in 2022 are 4 times as likely to die from pregnancy-related complications as white mothers are. And then newborns Black newborns have a 3 times the mortality rate of white newborns in this country, those are just terrifying, terrible statistics. And when we see what we see in terms of affecting those outcomes is when they do have physicians who are Black, in this case, as we're talking about, the mortality rates for newborns are sometimes reduced by 50%.
50%?
50%.
Oh my God.
So that's just an example of where diversity really does matter. And having that cultural competence, the shared experiences, and the trusting patient-physician relationship where physicians are actually listening to the patients really makes a huge difference.
Now, if I may get personal for a second, as a Black woman and a mother, how does that square with you? Those statistics, that 50% statistic, and you working in healthcare.
In healthcare, yeah. Well, I have a 21-year-old son, and I always cringe. Yeah, thanks. He made it to 21. That's amazing. When I was pregnant with him, I was considered a geriatric pregnancy, which is horrible. I was 39 years old. I was actually fortunate because I had a physician who happened to be Black. She was from the South. My family is from the South. We developed a really strong relationship throughout my pregnancy. I had a wonderful pregnancy, even as a geriatric mom, right? When it came time to actually have my son, immediately after he was born, I experienced an event that could have taken my life.
Oh, wow.
And my doctor, because she knew me, she listened carefully throughout my pregnancy, she knew my circumstances, she jumped into action super quickly, and I honestly believe she probably did save my life. And my son was born, he was born really healthy, and I could just, I was just talking with a couple of people in the last couple of days, and each one of them could relate to that experience and had friends who had died in childbirth. So it's not an uncommon experience. And this is why health equity is really important, and part of health equity relates to building that diverse pipeline of talent that will take the time and listen to their patients and build those trusting patient relationships. They do have an impact on health outcomes.
Yeah. Thank you for sharing that, first of all. But also, again, congratulations.
Yeah,
that's great. So, are we ready for a big, huge announcement? To start our morning, to kick off a big day?
Yeah.
Okay. So, to that end, how are you addressing these issues?
Yeah, at our company, health equity is really central to our mission. Our mission is to help make the health system better for everyone and to help people live healthier lives. And so health equity is squarely in the middle of that mission for us. So today we are announcing that we are going to invest $100 million in building a diverse and racially diverse and ethnically diverse healthcare workforce. So this will be through our UnitedHealth Group Foundation, and we will be providing sponsorships to 10,000 clinicians pursuing careers in healthcare. And we'll also, and it's split really, so it's like 5,000 who are probably going into more primary care related fields, but it's also for 5,000 current healthcare professionals who want to grow their careers. So there may be like medical assistants, there may be others who are seeking additional degrees and accreditation or certifications, and these scholarships will allow them to pursue advanced degrees within healthcare. And it'll be outside of the primary care specialty, so not just for nurses and for physicians, but and not for just general practice specialties, but also for mental health. We've talked about how important that is right now, behavioral health, mental health, midwifery, referencing the situation that I just described in my own personal experience. And this will be for over 4 years. Students will be able to get up to $20,000 to support their education. So we are really, really excited
Build that
about
pipeline.
that.
Yes. Great, that's wonderful. Just say that again. I've never been in a situation where I could say $100 million.
$100 million, yeah.
Wow. Oh boy. Okay.
It's huge.
Well, congratulations. That's wonderful.
Thank you.
Build
Thank
that
you.
pipeline. I know a lot of young people out there, or just anyone in their lives, are looking to get into healthcare.
Yeah, it's super important.
So now that you have that commitment and you're looking down the road, you seem like a very visionary person. So 10 years down the road, what does that look like? What is the road ahead? How do you see things mapping out, taking that HR, workforce development, needs in the healthcare system?
There's a lot of factors here. I mean, I think, health equity, there's a ton of underlying issues around health equity. So the first, what we're talking about today, is kind of building the competence in the workforce to be able to treat patients, and to build those trusting physician and patient relationships, and to do that on a consistent basis. So filling that pipeline is super critical. $100 million, even though it's a big number, it's not going to solve all the problems, but we think it will at least, we'll do our part to continue to advance that pipeline. Down the road, I mean, we still have a lot of work to do around addressing some of the health disparities that exist in our health system. Social determinants of health and all of those things are factors. But at least, 10 years down the road, we'll have a lot more clinical professionals, at least 10,000 of them, according to our goals, in the system to be able to support. So, this is a start. It's, there's a lot more to do in this area.
Yeah, and in 10 years, your son is going to be 10,
yes,
11.
Well, hopefully he'll have a plan.
Yeah. And so,
Yeah.
you also have the sustainability lens in your work. What kind of world do you see for your son in 10 years in terms of the work you're doing?
First of all, just explaining what I do, he struggles to understand all of that stuff.
Yeah.
But, I think, the work of sustainability encompasses a number of different things: environmental, social. We're talking about a lot of that. Health equity fits squarely in the social arena. I hope that he will be proud of the advancements that we've made, and the small part that we can contribute, and I personally can contribute to that mission. So
that's wonderful. Well,
thank you.
90 days in,
yeah,
you're already making announcements.
That's right.
$100 million. So let's reconvene in 180 days.
Okay.
See what other big work you've achieved by then. You're,
All right.
you're a fast, quick worker.
Thank you.
Well,
I'll
congratulations
take that
on
on.
everything. Thank you so much for joining us at the summit.
Thank you.
We do want to catch up, hopefully next year,
Yeah.
and see where you are in things,
Fantastic.
and continue to support you along the journey.
Thank you.
Okay.
Appreciate it very much.
Thank you.